Good morning, everybody.
Good morning.
Thank you for joining us today as we recognize and celebrate the work being done through the Flexible Housing Pool Program of Chicago and Cook County. I'd like to recognize the officials and community leaders who are here supporting this good work. Christine Riley, who's Director of Homeless Prevention, Policy, and Planning for the City of Chicago. Israel Rocha, our own CEO for Cook County Health. Keiki Hinami, who's a Director of Applied Research for the Center of Health, Equity, and Innovation at Cook County Health. That's a mouthful. Program participants Adrian and Dwayne, and representatives from a variety of organizations who are supporting the work being done by the Flexible Housing Pool Program. We're grateful for your help and support. Several years ago, the National Coalition for the Homeless pointed out that homelessness and health care are intimately interwoven. Poor health is both a cause and a result of homelessness. Given this fact, I'm proud to be here today to recognize the milestone achieved by the Flexible Housing Pool and to celebrate the success of the program. Today, we celebrate the successful placement of 1,000 residents into permanent supportive housing through the program. As we look to envision a more equitable and healthy Cook County, this work is critical, and the numbers speak for themselves. In Chicago, over 70% of the individuals experiencing homelessness identify as Black, while only representing 30% of the general population. It's therefore commendable and in alignment with what we are seeing in our community that 78% of the program's participants identify as Black. We also recognize the connection between those experiencing homelessness and those experiencing a serious mental illness, substance abuse disorder, or involvement in the justice system. Among our participants in the program, 60% of adults are identified as having a serious mental illness. 70% of adults and 21% of the youth have experienced some sort of substance abuse disorder. And 38% of adults and 23% of the youth were involved in the justice system. These folks represent the members of our community with the greatest need. And it's programs like the Flexible Housing Pool, programs with low barriers that get individuals connected to resources quickly, that are the types of programs necessary to ensure the health and safety of Cook County communities. Now, we're going to hear from a number of folks, and I would ask only that you introduce the person who follows you. So in my case, that's Christine Riley, again, Director of Homeless Prevention, Policy, and Planning for the City of Chicago. Christine? Sure enough.
Good morning.
Good morning.
I would like to thank President Tony Preckwinkle and the wonderful staff at Cook County Health for their continued commitment and investment in the Flexible Housing Pool, as well as the time and dedication of Dr. Keiki Hinami and team for making the early impact evaluation a reality so that we can see the success of this program. Thank you to Pete Topher from the Center for Housing and Health and all of the funders and stakeholders of the Flexible Housing Pool, and a special thank you to all of the participants for trusting this initiative. The Department of Family and Support Services believes that our most vulnerable residents need housing stability. Cook County Health evaluation that have provided us insight on how permanent housing has decreased the number of days in emergency rooms, has broken down many barriers, and have prohibited some populations from getting into housing. The city will continue to invest in better health because it is key to a better life. DFSS is proud to be an annual contributor to the FHP, as well as the lead government administrator. The city continues to work with Cook County in obtaining additional data for the next phase of their evaluation. The success of the program is due to all of the partners who believed in this effort, and housing over 1,000 participants since its inception is nothing short of amazing. Thank you again to Cook County Health, the Center for Housing and Health, Corporation for Supportive Housing, all of the funders, and that list continues to grow. And last but not least, the FHP participants for your willingness and saying yes. And now I would like to bring to the podium Israel Rocha, Chief Executive Officer for Cook County Health. Thank you.
Thank you so much. Good morning, everybody.
Good morning.
We are so honored and excited to be here today to celebrate the work being done by the Flexible Housing Program of Chicago and Cook County. Cook County Health has been working in the housing and health space for quite some time. Thanks to President Preckwinkle for her ongoing support, the Board of Commissioners, our county board, and all who make sure that we have and are taking amazing strides to achieve health equity. I would also like to acknowledge Shannon Andrews, Cook County Health's Chief Equity and Inclusion Officer, who has been doing great things in the housing and equity space. I'd also like to recognize Chante Gamby, who is the Housing Coordinator at Cook County Health. Patients experiencing homelessness face multiple challenges in accessing care and stabilizing their healthcare conditions. Without access to safe, stable, affordable housing, we know that people will struggle to achieve their optimal health. At Cook County Health, we see the impact daily. We provide health services to a large percentage of single adult homeless individuals in Chicago and throughout Cook County. We know that there is a better way of providing care than treating an individual for their immediate condition and then sending them back to the street for their full recovery or to a shelter that can sometimes not have all the equipment and assistance that is required to make sure that everyone reaches their optimal health condition and stability. We're hoping that we'll be able to follow up their medical regimen and return to follow-up visits in these types of programs. Research shows that housing homeless individuals decreases emergency room costs by nearly 61%, healthcare costs by 59%. The number of general inpatient hospitalizations decreased by 77%. That is a staggering statistic across the board at every level, that simply by uniting housing and healthcare together, we can help individuals live their healthiest life. That is the mission of Cook County Health. It has been said that it takes a village. Today, this is the village to make sure that we all are living our most healthiest life. Investing in strategies to house individuals and families while providing them access to preventative health care is a strategy that reaps enormous benefits to the society as a whole, and we are committed to achieving those aims. I am grateful for the work being done for the Flexible Housing Pool team and thankful to all the organizations who have made this a reality. All of our enterprises across Cook County Health, from our acute care division, our ambulatory care division, our Equity and Change Institute, our county care plans and programs, are invested in ensuring that these programs succeed, that we help individuals in their entire span of health, and that we make health a human right by ensuring that everyone can achieve their healthiest life together, with the full support of our organization, our community, and all the enterprises across Cook County Health, Cook County, and all willing providers who want to lend a hand. We thank everyone who makes this possible. I'm pretty sure there are many, many people that we have forgotten. Please know that we thank you. We thank you for helping to change the lives of 1,000 individuals, and we look forward to changing 1,000 more. I'll now give a few remarks in Spanish. Es un honor estar aquí hoy para celebrar el trabajo realizado del Programa de Vivencia Flexibilidad de Chicago y el Condado de Cook. Los pacientes sin hogar enfrentan muchos desafíos para ascender el cuidado médico y estabilizar sus condiciones de salud. Sin acceso a vivencias seguras, sabemos que personas pueden tener dificultades para lograr una salud óptima. Agradezco el trabajo realizado por el equipo del Flexible Housing Pool y agradezco a todas otras organizaciones como Cook County Health que han visto el valor de invertir en programas como este. Hemos cambiado las vidas de más de 1,000 personas y queremos hacer el cambio para 1,000 más. Thank you for everyone. Thank you for helping us to achieve this milestone. And as we said, we are just getting started and look forward to making even more change in the lives to come. Healthcare is a fully integrated enterprise, and we look forward to working with everyone who wants to commit to change lives. Next, it is my pleasure to bring forward Dr. Kiki Hanami, who is the Director of Applied Research for the Center for Health Equity and Innovation at Cook County Health.
Good morning.
Good morning.
So my name is Keiki Hinami. I am a physician at Cook County Hospital, John H. Sturger Hospital, and I oversee some of the great housing programs that Cook County Health Center for Health Equity is leading. The Flexible Housing Pool of Cook County in Chicago, also known as FHP, is a distinctive housing program compared to many traditional programs. On this occasion of 1,000 persons being housed, the success of FHP may be best characterized by how the program has fulfilled some of its principal goals. And these goals are, one, to enhance coordination among agencies supporting the region's crisis systems. Two, to expand the pool of permanent supportive housing for frequent users of the crisis systems. And three, to improve their health. To consider the first of these goals, the FHP indeed enhances coordination among agencies supporting the region's crisis system. We use joint data from across the health, criminal, legal, and homeless services sectors to identify frequent users of crisis resources. Using this data, we found that persons housed in FHP's permanent supportive housing intervention was associated with a 22% relative risk reduction in jail registrations, 19% reduction in emergency department visits, and a 33% reduction in incurring inpatient days. And these numbers are slightly different from the numbers quoted by Mr. Rocha just a moment ago, but note that we are measuring the impact of FHP during some of the most chaotic years of the COVID-19 pandemic. And this is relative to the general base trend, where we have seen a further reduction in crisis system utilization. Stable housing is shown through our evaluation to be a more compassionate, rational, and effective approach to addressing needs that are still being met incompletely through the crisis resources that we have. For goal number 2, the FHP expanded the pool of permanent supportive housing. As many here are aware, permanent supportive housing is traditionally available to people who meet stringent criteria set forth by U.S. Housing Development, Department of Housing and Urban Development. But people who fall outside of these stringent criteria are often phenotypically indistinguishable from those who qualify. The FHP developed and implemented a data-driven system for identifying adult candidates who are traditionally neglected in the housing system. For example, those more likely to have a serious mental illness and substance use disorder. And notably, as also noted by President Preckwinkle, we were also successful meeting equity goals by housing a cohort that's 78% Black African American clients. And then finally, for goal number 3, the FHP measurably improved health outcomes. During the COVID-19 pandemic, the crude all-cause risk of death among people experiencing homelessness spiked to around 1,600 out of 100,000, which is double that of the general population. Specifically, deaths from substances drove this spike to 30 times that of the general population. From preliminary analysis of the evaluation, we found that persons housed in FHP experienced a 30% reduction in the risk of death. We're still investigating the mechanisms of service delivery through FHP that may still mitigate the risk of fatal overdoses. But again, intimating here that a humane response to poverty and social injustice may be a solution to the scourge of substance-related fatalities that continue to rise in our region. Details of the evaluation can be found in the now public document, the Early Impact Evaluation Report. The evaluation work continues with a primary data collection effort and another planned cross-sector data linkage that will examine the intermediate-term impact of this enormously successful program. Many thanks to the agencies that contributed data to this evaluation: Cook County Health, County Care, Illinois Department of Public Health, Chicago DFSS, through All Chicago, and the Alliance to End Homelessness in Suburban Cook County, and of course, the Center for Housing and Health. Thank you very much. Now I pass the baton to Pete Tepfer, representative from Center for Housing and Health.
Thank you, Dr. Hanami. My name is Pete Tepfer, and I'm the Executive Director of the Center for Housing and Health, a nonprofit organization that serves as the administrator for the Flexible Housing Pool project. I'm thrilled to be celebrating these incredible milestones with this group today. Too often, our siloed systems get in the way of ensuring that our neighbors have the human rights that they deserve, human rights like healthcare and housing. In the process, our neighbors are suffering unnecessarily, and as Dr. Hanami pointed out, dying unnecessarily. After all, the experience of homelessness is the failure of systems, not the moral shortcomings of the individuals that get trapped in it. But the flexible housing pool is an example of what can happen when we work across systems, across sectors, and across geography, when we collaborate and invest in solutions that work. The outcomes that Dr. Hanami shared are a testament to the resilience of our communities, certainly to the resilience of the participants in the flexible housing pool, but also of the organizations that envisioned a better future. Groups like Cook County Health and County Care, the City of Chicago, CSH, our philanthropic community, and UI Health. This community believed that we could be successful and saw us through some of the darkest days of the COVID-19 pandemic. The achievements wouldn't have been possible without the support of our incredible partnerships, including 12 community-based organizations, some of whom are here today, including Deborah's Place, who's generously hosting us, and whose staff deliver the life-changing supportive services that are the glue between safe and stable housing and the health outcomes that we all hope that our community members can achieve. We have a bold vision where all Cook County residents who experience homelessness and interact with public crisis systems will have a stable home and access to the health care that they need. With today's important achievement, the flexible housing pool is well on its way to achieving the vision of serving 5,000 people over the next 10 years. Change never happens alone. Only together can we continue to move forward toward ending homelessness and improving the health of our communities. Thank you very much. And with that, I'd like to introduce Dr. Yvonne Collins, Chief Medical Officer of County Care.
Good morning. Thank you. This is a historic day and represents the power of community and collaboration. We have housed more than 1,000 vital members of our society. We have helped house mothers, fathers, sisters, brothers, and children. County Care stands proud today. We initially invested because we understand as a health plan that the health care extends beyond the walls. We understand that housing is health. Just like insulin for diabetes and beta blockers for hypertension, housing is therapeutic. You may ask how. It can prevent disease. It increases quality of life. It decreases poverty and decreases carbon emissions. We also know that stable housing decreases morbidity and mortality. It decreases healthcare costs, as has been showed. It improves mental health. It decreases teen pregnancy. It decreases early drug use, and it decreases depression. Housing has been linked to decreased blood pressure and cholesterol, decreased ER visits, hospitalizations, and recidivism. Housing access, that is to safe, affordable, and quality housing, improves health and well-being. Let's continue to be a part of the solution. This should be a proud day for all of us. Thank you. And I'll turn it over to Misty Drake of Wellness West.
Thank you, Dr. Collins. As you heard, I'm Misty Drake. I am the Executive Director of Wellness West, a nonprofit organization that brings together over 40 providers, including community health centers, hospital systems, community mental health centers, and community-based organizations. I am pleased to say that Cook County Health is one of our partners, as well as we are an investors into the flexible housing pool, in part because and solely because we recognize the benefit of the flexible housing pool and the outcomes, the wonderful outcomes that you've heard today. Wellness West is focused on over 200,000 patients who have Medicaid, as well as those that are uninsured, that live on the west side of Chicago that have chronic care conditions. We address social drivers of health that lead to a baby being born in a loop being less likely to live 12 years longer than a baby born in Garfield Park. One of the primary causes of that health inequity is housing insecurity. Based on the results of our over 8,000 universal health risk screening tool assessments we've completed in the past year, we've discovered a couple of things that is probably no new news to this group. 25% of our patients say that they are worried about losing stable housing. 16% say that they are currently housing insecure. And 9% reported not feeling physically and emotionally safe at home. Housing insecurity is our patient's third largest area of concern after food and transportation. We know that housing insecurity affects a person's health in all sorts of ways. For example, being uncertain about one's health situation can lead to anxiety and stress, which have a well-proven negative effect on one's overall health. Unstable housing negatively impacts access to health care, to see a medical professional, to hear a diagnosis, to receive treatment, and to obtain drugs. Wellness West is engaged in the flexible housing pool and our partners because we know the difference it can make in a patient's life. Wellness West is proud to be here today as a part of this important program and this important cause. Thank you. I am now going to introduce Tiffany Ice of Deborah's Place. Tiffany?
Good morning, everyone. Good morning. My name is Tiffany Ice. I'm Chief Operational Officer at Deborah's Place. We have had the pleasure of being a collaborative partners with the Flexible Housing Pool, and we are so excited to work with our participants on transitioning to safe and affordable housing, and we want to continue on this journey. So today is a celebration of housing 1,000 people who are experiencing homelessness, and Deborah's Place is committed to continue to help transition people to stable housing with support. Thank you. And I will now have a Flexible Housing Pool program participant come up and speak next. I'll have Adrian come up and speak for the Flexible Housing Pool. Thank you.
Hello, everybody. Good morning. Good day, everyone. My name is Adrian. I'm delighted to be here today and to share my journey and the incredible impact of the Flexible Housing Pool Program, also known as FHP. I'm 27 years old, and my journey with the Flexible Housing Pool Program began in 2020. That year marked a turning point in my life as I was accepted into housing and approved for Social Security insurance at the same time. I found myself facing homelessness due to a challenging and changing situation, including mental and emotional or stressful situation from my family, along with several other factors such as the desire to reconnect with my mother after about 15, 20 years. During this difficult time, I experienced periods of instability, moving in and out of shelters, sometimes relying on the kindness of friends, even spending some nights on trains. Thankfully, my time on the streets itself only amounted to about a month total. I want to express my gratitude to my friend Jason, who played a pivotal role in helping me access the Flexible Housing Pool Program through the Crib Night Ministry initiative. In my early months in Chicago, I faced the challenge of staying in shelter infested with bed bugs. Subsequently, I spent time in youth shelters, and when I'm not there, I was fortunate to have a safe haven with my friend Jason. My introduction to the Flexible Housing Pool Program was a surprising and hopeful moment. I received a text from my case manager at the time informing me of upcoming inspections by both CHA and FHP. At that point, I was made aware of FHP could serve a backup if I were to face difficulties with the Chicago Housing Authority inspection. Today we celebrate the 1,000th person housed through the Flexible Housing Pool Program. I stand before you as living proof of the transformative impact of this initiative. The program not only provided me with a stable place to call home, but also restored hope, dignity, and a sense of security in my life. I am eternally grateful to all the individuals, organizations, and advocates who make the Flexible Housing Pool Program possible. Together, we're changing lives and building a brighter and together future for those experiencing homelessness. Feel free to use these talking points as a foundation for your press conference, tailoring them as needed to convey your message effectively. Thank you.
Thank you. Dwayne. Introduce yourself.
How you guys doing? Good morning. My name is Dwayne Elliott, and I'm a part of the Flexing Housing Pool, transferred to CHA. A little bit about myself. About 3 years ago, I was currently homeless, and I ended up getting networked through the night ministry that helped me get into FHP, and they helped me get an apartment, a 2-bed apartment over on the east side of Chicago. And I ended up getting networked from there to CHA, and now I'm currently looking for a house right now. That's it. Thank you.
I want to thank everyone who joined us. Nick?
Any questions in the room? We have a couple of things with email. What does the future of the program look like? Are there plans for expansion? Israel or?
So we are looking to add additional resources through funds that we have received through ARPA, as well as continuing to look at investments from our county care division, as well as our equity initiatives at Cook County Health. And so we look forward to continuing to invest and grow the partnership.
From the city side, the city of Chicago this year has invested additional dollars from ARPA, and we will be able to house up to 88 youth over the next 3 years.
Any further questions, Nick?
Thank you, everybody.
Thank you for participating.